Hello everyone. So today we are going to read an important topic from systemic pathology, that is hepatitis. So let's move on. First, what are the types of hepatitis? These are A, B, C, D and E. अब हम इस पांचों टाइप्स के बारे में पढ़ेंगे अंडर द फॉलोइंग हेडिंग्स. फर्स्ट, causes, then type, then route, then prevention. Causes. For hepatitis A, it is hepatitis A virus. For B, it is hepatitis B virus. Similarly, it is hepatitis C virus, hepatitis D virus, and hepatitis E virus. So, let's know about the nature of these viruses. All of them are RNA viruses except hepatitis B virus, which is a DNA virus. This is important. Now let's know about the type of the hepatitis viruses. What type it can cause? Acute, it is caused by all the 5 types. Fulminant is the severe type of acute type only. So it will also be present in all the 5 types. Chronic, it is not present in hepatitis A and hepatitis E. It will be present in B, C and D. Now the route through which it spreads. Fecal-oral, it is common in hepatitis A and E and not in B, C and D. Now the other 3 routes are through sexual route, through parenteral route like through contaminated needles and syringes, and transplacental route, which is during pregnancy. So all these 3 routes are not common in A and E and common in the B, C and D type. So now coming towards the prevention, since type A and type E, these spread through fecal-oral route, so we can prevent it through hygiene. Now let's read about the 5 types under the other headings. Incubation period and causative agent in these following types. The incubation period in type A is 15 to 45 days. In type B, it is 30 to 180 days. In type C, it is 20 to 90 days. And in type D, it is 30 to 50 days. And in type E, it is 15 to 60 days. Remember, it is given in days and incubation period is important. Now, what are the causative agent of these viruses and the family to which they belong? These can be asked. So, the names are enterovirus. The broad term is picornavirus. It comes under picornavirus. For type B, it is hepadnavirus. For type C, it is hepacivirus. Type C and hepaci. These are common. In type D, these are viroids-like substances, and in type E, it is calcivirus. In hepatitis B, C, and D, we are seeing all the 3 types: acute, fulminant, and chronic. The chronic has further 3 types. All begins from C: carrier, cirrhosis, and hepatocellular carcinoma. Okay. Also remember, type A is most severe in children, type E is more severe in adults and pregnant ladies. Now we'll read in detail about type A and type B. Let's move on. So let's start. Since I told that hepatitis A is more common in children, so it is often associated in children with jaundice. Here, jaundice is not a disease but a symptom, just like fever, etc. And often these are curable. Now, what are the investigations to be done in hepatitis A patients or hepatitis A children who are suffering from hepatitis A? Stool examination and blood examination. In stool examination, we'll only get hepatitis A virus, not antibodies. Okay, but in blood, we'll get both hepatitis A virus and the antibodies. Antibodies are of both types, IgM and IgG. Since IgM is produced in acute cases, So we'll get to know about whether it is acute or chronic, and if IgG antibodies are present, means it is a chronic case. Now let's read about hepatitis B. Move on to the most important, hepatitis B virus. Okay, this is the structure of hepatitis B virus. There are three types of antigen present on it. First, on the surface, it will be HBs antigen. On the envelope, it will be HBe antigen, and on the core, it will be HBc antigen. HBc antigen along with DNA. Okay, this is the structure of the hepatitis B virus. Let's imagine it to be present inside the blood vessel, which is lined by endothelium. Since HBc antigen is present inside core, it will not come into blood, and DNA will also not come into blood. HBs antigen and HBe antigen will come into the blood. So antibodies will form against them. Anti-HBs antibody, anti-HBe antibody. But since this antigen is not coming inside the blood, so two types of antibodies will develop. Antibody IgG, antibody IgM. IgM denotes acute infection, IgG denotes chronic infection. I have already told about that. Now we'll read about the sequence of their coming, like sequence of coming of antibodies, antigens, and then about its significance. So let's recap first about the structure of HBB virus. DNA will be present inside core, followed by envelope and then surface. As we read, on surface HBs antigen will be present, on envelope HBe antigen, on core HBc antigen, and inside it DNA. As we read, when the virus enters inside the bloodstream, HBc antigen do not come into the blood vessels, as they are present at the innermost side in the core. So HBs antigen and HBe antigen comes. Now what is the sequence? Since HBs is present at the outermost side, it will come first, followed by HBe antigen. But the antibodies develop first against HBc antigen, which do not even come inside the blood. The HBc antigen has two types of antibodies, as we read, IgM, IgG. IgM for acute, IgG for chronic infection. First, anti-HBc antibodies will come of IgM type, followed by anti-HBc antibody of IgG type. But in between, since HBs antigen comes first, anti-HBs antibody will come, and HBe antigen comes later, so anti-HBe antibody will come at the last. HBs antigen comes first, followed by HBe antigen. Since HBs antigen comes first, HBs antibody will come first, HBe antigen comes later, HBe antibody comes at the last, but HBc antigen do not come at all. Still, two types of antibodies develop, IgM, IgG. IgM comes first, IgG later, in between HBs, HBc at the last. Now we'll read about significance, the last topic of today. First of all, antigen, antibody both can't be present simultaneously. Either antigen will be present or antibody will be present. First, let's start with the first one. If HBs antigen is present, it denotes infection. If HBe antigen is present or DNA is present, it indicates infectivity. Infectivity is ability to infect another person. Ability to infect another person. Okay. Now, HBe antigen denotes infectivity. HBe antibody will also denote infectivity. HBe antigen, if HBe antigen is present, it denotes high infectivity. If HBe antibody is present, it denotes low infectivity. Okay, since HBs antigen is present, denotes infection. HBs antibody, if present, denotes recovery, vaccination, or protection. Okay. Now moving towards HBc antibodies, if it is present of IgM type, it denotes acute infection. If it is present of IgG type, it denotes chronic infection. So if antigen is present, it is harmful because it is at the initial stage of the disease. HBs antigen present, it will denote infection. HBs antibody if present, it denotes recovery because it is at the later stage of the disease. If HBe antigen is present, it denotes infectivity, high infectivity. If HBe antibody is present, it denotes low infectivity. Similarly, if HBc antibody is present, if it is of IgM type, it denotes acute infection. If it is of IgG type, it denotes chronic infection. Also, DNA is also present. DNA is a quantitative marker, so it is better, but it is costlier. That's why HBe antigen is more appropriate for determining infectivity of the disease. Let's solve a few cases. It will make our concept more clear. Now let's read about significance of the sequences we read. These are not written in sequences, these are just written like HBs antigen, HBs antibody, HBe antigen, HBe antibody, and HBc antibodies, which might be of IgM type and IgG type. These are the 6 cases, 1, 2, 3, 4, 5, 6. Now we'll diagnose. If HBs antigen is present, which denotes it is the first antigen to come, so it denotes that it is an acute case. Acute hepatitis B case. Also IgM is present, which denotes acute infection, and HBe antigen is present. Antigen denotes high infectivity. So acute hepatitis B with high infectivity. Again, HBs antigen is present. HBs antigen it usually comes first, so it is an acute case again, and IgM is present. So it is an acute case, acute hepatitis B case, but antigen is absent, antibody is present. Anti-HBe antibody denotes low infectivity. So acute hepatitis B with low infectivity. Now antibody is IgG. So these both are chronic cases, chronic hepatitis B cases. Now to determine infectivity, antigen is present, antibody is present. Antigen present, high infectivity. Antibody present, low infectivity. Remember, HBe antigen denotes high infectivity. HBe antibody denotes low infectivity. Now let's move on to the 5th case. HBs antigen is not present, antibody is present. Remember, if antibody is present, it is at the later stage of the disease. So this is the case of recovery. I already told you, if anti-HBs antibody is present, it denotes either recovery, vaccination, or protection. Whereas if HBs antigen is present, it denotes infection. It denotes vaccine, protection, recovery. So this is the case of recovery, and IgG is present, so it is at the later stage. HBe antibody is present, low infectivity, and HBs antibody present, so this is a case of recovery. Now the last case, HBs antibody is present and nothing else is present, so this is a case of vaccination, that is immunized. What do we do in immunization? Dead antigens are given so that antibodies could develop. So if the disease really manifests, the antibodies pre-developed will kill the antigens and will protect us from the disease. So This was all about hepatitis, the 5 types of hepatitis. Hepatitis A and hepatitis B we read in detail. Hepatitis B is most important. So these usually come in NEET PG. So thank you. My source was an academy. I read from a lecture of hepatitis from there, and I tried to summarize it and make it easier for you. Hit like and don't forget to subscribe if it really helped you. Thank you so much.